We've seen results and extended results from at least 2 trials that directly impact the practice in the adjuvant setting. One is we have data from the Olympiad trial looking at adjuvant PARP inhibitors in patients with germline BRCA mutations, and we also saw extended follow-up data and the first interim overall survival analysis of the adjuvant Monarch E trial informing the use of abemaciclib in the adjuvant setting. There are several ongoing trials that will also impact the adjuvant setting in hormone receptor positive disease. But for now, the recent data from San Antonio, ESMO, and ASCO really help us in informing what we do for our high-risk patients as well as our genetically high-risk patients in the adjuvant setting. Black women, despite having a 4% lower incidence of developing breast cancer, have a 40% higher mortality after being diagnosed with breast cancer when compared to white women. And this disparity is something that can not be fully explained by social determinants or socioeconomic differences between these populations. There are many actually biologic factors that may be contributing to these differences. This includes biologic factors within the tumor itself. So we do know that breast tumors in Black women tend to be more proliferative, less hormone sensitive, more aggressive in general than tumors that are diagnosed in white women. We also are seeing data that the tumor microenvironment is significantly different by race, particularly in Black women compared to white women, such that the tumor microenvironment may not be as protective in Black women versus white women. And finally, we also know that host factors are different between these populations. This includes metabolic hormones, inflammatory hormones, adiposity, obesity, all of these issues. And I think it's important to point out that no one factor, for example, obesity, cannot explain the differences in outcomes between these populations, and we need more precision trials for risk stratification to really understand what are the driving factors between these populations.